Hello friends, I hope every one of you are fine. Last time we had discussed about pharmacokinetics. Now today we are going to continue the topic as it is a lengthy topic. So today we are going to discuss about route of drug administration. Okay. Drug to provide its therapeutic effect need to be administered within the body. The route of administration is determined by the chemical properties. Point to be noted, it is determined by the chemical properties of the drug. Okay. Chemical properties of drug like solubility, either it is water soluble or lipid soluble, ionization properties, etc. And the second point to be noted is the route of administration is also determined by the therapeutic objective. Okay. What's out of therapeutic objective is in need, like onset of the drug action, need of long term treatment, or restriction of drug delivery to the local site. So what are the major routes? Major routes of drug administration. The most common route are enteral route, okay, and then is parenteral route and topicals. Enteral includes oral and sublingual or buccal route of drug administration. Parenteral include intravenous, intramuscular, subcutaneous, and other route. Topical when drug action is required in a localized place, okay, at a local site. And others route of drug administration are rectal, okay, like suppositories, arguments, and vaginal bogies that are also suppositories, intrathecal, okay, and transdermal, and other mode of drug administration. So let us discuss about enteral route of drug administration. Enteral administration, that is administering a drug by mouth, is the most common, convenient, and economical method of drug administration. The drug may be swallowed, allowing all oral delivery, or it may be placed under the tongue, that is sublingual, okay, or between the gums and cheeks, that is buccal. If we are placing the drug, okay, if we are placing the drug under the tongue, okay, under the tongue, not above the tongue, under the tongue, that is sublingual. And if we are, suppose this is our tongue, this is teeth, and if we are placing here under the tongue, okay, then it is sublingual. And if this is cheek and this is gum and here are teeth, and between the cheek and the gum, okay, here, if we are placing the drug here for absorption, then it is a buccal route of drug administration. This is a rough figure, okay, just for discussing. So what is the benefit of sublingual or buccal? They facilitate the direct absorption into the bloodstream. Okay, if we are taking orally, then the drug passes through the esophagus, reaches stomach, small intestine, large intestine. Okay, but if we are placing it directly under the tongue or between the gum and the cheek, that is buccal region, then direct absorption of drug takes place into the blood bypassing the harsh GI environment. Okay, now let's move for the detail of oral. Oral administration provide many advantages. Okay, what are the advantages and disadvantages of the oral drug administration? We will discuss it more detail in coming lectures. Let's discuss in brief. Oral drug are easily uh, we are going to discuss about advantages. Okay, oral drug are easily self-administered. We can take it easily by ourselves. If we need to take injection, we need help. But if it is not injection, some tablet or capsule or powdered dosage form or some solution for oral preparation or syrup or elixirs that can be easily self-administered. Okay, and the toxicities and or overdose of the oral drug may be overcome with antidotes. Suppose we have taken some oral drug like paracetamol in very high dose that can cause the peptic ulcer. Okay, so for that we can take acetylcysteine or as antidote. So for oral drug we can take uh, antidotes. Suppose some drug had made poison, we have someone has taken poison. Okay, and for that as antidote, we can take also drug like activated charcoals. However, the pathway involved in the oral drug absorptions are the most complicated. That is the demerits of oral drug. Okay, and the low gastric pH inactivates some drugs. Low gastric pH. So when we take the oral drug, it passes through the esophagus. Okay, reaches to the stomach. Okay, stomach there is acids known as hydrochloric acid. Acid has the pH less than 7. Okay, pH is less than 7 for the acid. So some drugs when taken and when they reach to the stomach due to the acidic environment about 2. Okay, the drug is deactivated or inactivated. A wide range of oral preparation is available, including enteric coated and extended release preparation. Enteric coated preparation. Okay, why these preparations are available? To overcome such problems like inactivation by acids or metabolism due to the enzymes presence in esophagus, stomach. So, what are enteric coated preparations? Enteric coating is a chemical envelope that protect the drug from stomach acid. Okay, for example, we need to take drug for gastritis, which is a PPI known as omeprazole. Okay, OMEPRAZOLE. That is omeprazole. It is proton pump inhibitor. Okay, when we take this drug, when omeprazole reaches to the stomach, it gets deactivated. So omeprazole is coated with chemicals so that it can bypass this harsh environment and reach to the small intestine, and this chemical get dissolved here and omeprazole is released and absorbed. So an enteric is a chemical envelope that protects the drug from stomach acid, delivering it instead to the less acidic intestine, where the coating dissolves and releases the drug. This is the case we are discussing. And for the drug that are irritating to the stomach, such drugs are also have enteric coating, for example, aspirin. Now let's discuss about extended release preparations. Extended release preparations are abbreviated as ER, okay, not in small but in capital letter, that is extended release, or XR, or SR, that is sustained release, or XL, etc. Okay. Extended release medication have special coating or integrants that control drug release. Okay, they have coatings, special type of coatings, that is chemical coatings. Okay, or ingredients that control the drug release, thereby allowing for slower absorption and prolonged duration of action. The release is controlled. When drug release is controlled, a little amount of drug is released. So if less amount of drug is released, less amount of drug will be absorbed. Okay, and since slowly it is releasing a certain amount of drug, prolonged duration of action is achieved. Okay, formulation can be dosed less frequently and may improve patient compliance. In addition, formulations may maintain concentration within the therapeutic range over a longer duration. Formulation are advantages for drug with short half-life. For example, the half-life of oral morphine is 2 to 4 hours. Okay, so if its half-life is 4 hours, to maintain the therapeutic range, okay, therapeutic concentration, we need to administer administer it for 6 times daily to provide continuous pain relief. However, only 2 doses are needed when extended release tablets are used. Now let's move to the sublingual or buccal routes. The sublingual route involves placement of drug under the tongue, as we have previously discussed. Okay, and the buccal route involves placement of drug between the cheek and the gum. Both the sublingual and the buccal route of absorption have several advantages, including ease of administration, rapid absorption, bypass the harsh gastrointestinal environment, and avoidance of first-pass metabolism. So, what is first-pass metabolism? We will discuss first-pass metabolism in detail separately. It is an important topic. First-pass metabolism. This will be discussed. This will be discussed separately in upcoming lecture. Okay. Uh, and now let's move to the parenteral route of drug administration. We have discussed sublingual too. So parenteral route of drug administration includes intravenous, intramuscular, which is abbreviated at IM, subcutaneous, and intradermal. So let's discuss it in detail. Parenteral route introduce drug directly into the systemic circulation. Parenteral mode of drug administration. The parenteral route introduces drug directly into the systemic circulation. Since the drug is directly introduced into the systemic circulation, that is into the plasma, there is no absorption phase. As we had discussed this in previous video, parenteral administration are used for drugs that are poorly absorbed from the gastrointestinal tract, for example heparin, or unstable in the GI tract, for example insulin. Parenteral administration is also used for patients unable to take oral medication, that is patient is unconscious and in the circumstances that required a rapid onset of action. The rapid action, okay, onset of action is required, then parenteral route is used. Okay. However, the route of administration is irreversible and may cause pain. Since it is injected using a syringe, it may be painful at the site of injection, or it may cause the irritation at the site of injection, and it is irreversible. It is directly placed into the plasma, so there is no any antidote to reverse the action. Prompt action is will take place. It can cause fear, local tissue damage, and infections if not sterile. The four major parenteral routes are intravascular, that is intravenous or intraarterial, intramuscular, subcutaneous, and intradermal. So let's discuss about intravenous, that is IV. Is the most common parenteral route. It is used for the drugs that are not absorbed orally, such as the neuromuscular blocker, rocuronium. IV delivery permits a rapid effect and the maximum degree of control over the amount of the drug delivered. When injected as a bolus, the full amount of drug is delivered to the systemic circulation almost immediately. If administered as an IV infusion, the drug is infused over a long period of time. Okay, we can give it as a bolus using a syringe. Okay, or as a IV infusion, like in normal saline, DNS, RAL. Okay, The drug is infused over a longer period of time if you are giving by the infusion, resulting in lower peak plasma concentration and increased duration of the circulating drug into the plasma. Now let's move to the intramuscular, that is IM. Intramuscular route of administration. Drug administration administered intramuscular can be aqueous solution, which are absorbed rapidly or in specialized depot preparation, which are absorbed slowly. Okay, depot preparations often consist of a suspension of drug in a non-aqueous vehicle such as polyethylene glycol as the vehicle diffuses out of the muscle. Okay, vehicle diffuses out of the muscle, the drug precipitates at the site of injection. The drug remains there. Suppose this is this is hand of someone. Okay, here drug is given here in the depot form. Depot form contains non-aqueous vehicle drug. This is non-aqueous vehicle and drug is placed inside this aqueous. As is injected, the non-aqueous matter diffuses out and the drug remains there. And this drug dissolves slowly, providing a sustained dose over an extended interval of time. Okay, in IM. Now let's move to the subcutaneous. Okay, it is like IM injection. Subcutaneous injection provide absorption via a simple diffusion and is slower than the IV route. Subcutaneous injection minimizes the risk of hemolysis or thrombosis associated with IV injection and may provide constant, slow, and sustained effect. This route should not be used with a drug that causes tissue irritation because severe pain and necrosis may occur. Okay, now let's move to the intradermal, that is ID. The intradermal route involves injection into the dermis of skin. Okay, the more vascular layer of skin under the epidermis. Dermis is more vascular than epidermis, which epidermis is the layer of skin and dermis is also layer of skin. Agent for diagnostic determination and desensitization are usually administered by this route. So let's move to the topical. Topical is Topical application is used when a local effect of the drug is needed. And last is others, which include rectal, vaginal, intrathecal, and transdermal. In rectal, let's discuss about it. Because 50% of the drainage of the rectal region bypasses the portal circulation, the biotransformation of drug by the liver is minimized with rectal administration. The rectal route has the additional advantage of preventing destruction of the drug in the GI environment. This route is also useful if the drug induces vomiting when given orally, if the patient is already vomiting, or if the patient is unconscious. Rectal absorption is often erratic, that is, not a rational way of absorption, and incomplete. Okay, and many drugs irritate the rectal mucosa. Rectally, we give enemas or suppositories, paracetamol suppositories. Okay, now let's move to the vaginal. Buggies are given vaginally. That are suppositories. And now let's move to the intrathecal or intraventricular. The blood-brain barrier (BBB). Okay, blood-brain barrier, that is BBB, typically delays or prevent the absorption of drug into the central nervous system. So what is BBB or blood-brain barrier? It is a layer, okay? It is a barrier that prevents the absorption of drug into the CNS. When local rapid effects are needed, it is necessary to introduce directly into the cerebrospinal fluid. So the route is intrathecal, in which we introduce drug directly into the cerebrospinal fluid, or this is also known as intraventricular. Now let's move to the transdermal route of drug administration. This route of administration achieves systemic effect by application of drug to the skin. Okay, derma means skin. Transdermal means we place the drug directly on the skin, usually via a transdermal patch. The rate of absorption can vary, okay, depending on the physical characteristics of the skin at the site of application as well as the lipid solubility of the drug. And others also include the oral inhalation and nasal preparation. Okay, so we will like to conclude the topic. Thank you for watching the video. Next time we will be going in detail about absorption of drug. We will talk about the mechanism of absorption of drug from GI tract, factor influencing the absorption. Okay, so as it is a lengthy topic, we will discuss in parts. Thank you for watching the video. Have a good day. See you soon.